My name is Kelsey Powell. I'm going to discuss my paper on the roles of a professional nurse. So, the AACN describes many different roles that nurses have, and these include a planner, a coordinator, a designer, a manager, and a provider of care. Each of these roles are used every single day, every single shift, and they're all very, very important. So, in my paper, I use the example of a nurse being a coordinator when discharging a patient from the hospital. So, during a discharge, you're going to print out all the necessary paperwork and you're going to educate your patient on everything they need to know about, you know, what to expect when they go home. So, if they have an incision, teach them, how to wash it and how to keep it free of infection. If they have any new doctor's appointments, you're going to tell them when they're expected to be there and the phone numbers and all that kind of stuff. And then also, you're going to gather all their belongings, make sure they have a ride home. And it's also very important to include the family in discharge teaching, especially if the patient has a new medication or something. If you don't educate properly and coordinate this discharge, the patient and the family member may leave confused, and this can lead to readmission very quickly. So, being a coordinator is very important. Also, in my paper, I talk about direct and indirect care. So, nurses use both of these every day also. With direct care, that's everything that you do face to face with a patient, interaction when you do your assessment, taking a patient history, all that kind of stuff. Basically, whatever the patient sees or whatever the family sees, that's direct care. And indirect care is basically the stuff behind the scenes. So, like charting or going over lab values, talking to other members of the healthcare team about the patient's care. That's all indirect. And both of those are very important. Use direct and indirect care every single day as the different roles that we have as a professional nurse. So we must know the difference between both of those. So we were asked in our paper to explain how the patient, the family, and the community is affected by the professional nurse's roles. As I stated earlier, the family should always be educated, not just at discharge, but throughout the whole patient stay. And I found in my career that when I educate the family, they have a better relationship with me and they trust me more and they just feel more comfortable in general. So they're not scared to ask questions or anything like that. So I use the example of me having an intubated and sedated patient and having to do oral care every 2 hours. So I like to just go in the room and explain what I'm doing and why. So I would just tell the patient's family, I'm cleaning their mouth out to prevent hospital-acquired pneumonia. That's one of the easiest teachings to give the family because it's simple enough for them to understand, especially if they're not familiar at all with anything in the medical field. So that kind of opens up a door for them to be more open and honest with me about, the care or ask questions and without feeling dumb. Because I found a lot of times that patients' families just they want to ask a lot of stuff, but they can't. They feel like they can't because they don't want us to like look down on them or something. So I just find it really important and necessary as a professional nurse to go in, introduce yourself, and tell them you're open to questions. Like make them feel comfortable. If that were your family member in the bed, you would want your family member's nurse to be that way. So that's kind of how I look at everything. I kind of put myself in their position. So on the community side, I use the example of the flu shot being administered to patients. So during the fall and winter months, which is coming up now, my hospital, we always encourage the patient to get their flu shot before discharge. So I kind of like to educate my patients on the importance of getting the flu shot. Tell them that the community may be affected because elderly people and people with weakened immune systems, if they get the flu, they may become very, very ill. So the flu shot really does affect the community because if I don't do my job and administer the flu shots to patients that are able to have it, a higher chance that the flu is going to spread more rapidly than it would if everyone has the flu shot. The most important roles as a nurse, in my opinion, is the role of an educator. I work in the neuro ICU, so I educate all the time, which I know everyone does, but I have stroke patients almost every day. So the example that I use in my paper is, say I have a stroke patient come in and they can't move the left side of their body, but they get TPA and they come up to my unit and I have to explain to them, sometimes this medication takes a while for it to start working. So I have to tell them, you're on bleeding precautions and you can't get up for 24 hours. If you get up and fall, then you're at a high risk of having a head bleed. So that is really, really important when dealing with patients with TPA. So once the patient starts to regain their strength back and is able to move a little bit more, I'll incorporate physical therapy. So physical therapy will come see them and work with them. And I also like to be very encouraging because I found that most stroke patients just feel helpless, especially, when their strength doesn't come back as quick as they want it to. Really educating my patient, that will encourage them even further because then they'll understand, I've got to be patient and I've got to give this time, but I've also got to work hard and be independent. So I really do think that education is an essential part of being a nurse. I know I only talked about a couple of different roles that we have as nurses. Um, like I said earlier, the AACN's list of roles that they have, a planner, a coordinator, designer, manager, and provider of care should all be recognized because, our career, we have so many roles and responsibilities that we take on every day. And before writing this paper, I mean, I knew my job was super busy, but like before I wrote this paper, I never really sat down and thought about what all I actually do. I think it's good for us to, take a step back as nurses and really just admire all the hard work that we do because it's pretty impressive in my opinion. Even though this paper was difficult for me and this video is definitely difficult for me, I really did enjoy, you know, learning about all the stuff that I accomplish at work. It makes me feel good and I have pride in my job and I love what I do. This assignment has kind of made me feel better about, when I have a hard day's work like today, I feel accomplished thinking about everything that I've done and all the people that I've helped. And it's nice. It's a nice feeling. That's all that I have. I touched base on what I felt like was the most important parts of my paper. So I hope everyone has a great night and a great semester, and War Eagle.